Beware of these 8 foods if you want to safeguard your kidneys' well-being. Did you realize that nearly 40 million individuals in the United States alone suffer from chronic kidney disease? This staggering number underscores the critical need to prioritize our kidney health. While we often hear about foods that affect our heart, liver, and stomach, it's time to shine a spotlight on our kidneys. These remarkable organs work tirelessly day in and day out, but they're not invulnerable. Poor dietary choices can wreak havoc on them. Today, we're here to shed light on this crucial issue. Your kidneys play a vital role in filtering your blood, removing waste, regulating minerals, and maintaining fluid balance. When they're compromised, it can lead to a host of health issues. So, the big question is, what are the foods that can be destructive to your already sick kidneys? That's what we'll be exploring today. We've carefully selected 8 foods that you should avoid to protect your kidney health. These 8 culprits are not just your ordinary items in the kitchen. They are sneaky, often hiding in plain sight, and can exacerbate kidney problems if consumed excessively. We'll be discussing each one in detail, so make sure you stay tuned to find out if any of your favorites made the list. But wait, there's more. Alongside each food item, we'll also provide some kidney-friendly alternatives so you don't have to sacrifice taste for health. Remember, knowledge is power, and by the end of this video, you'll be armed with the information you need to keep your kidneys healthy. 1. Sodium-rich foods. Sodium is a mineral found in salt and many foods. While sodium is essential for maintaining fluid balance, nerve function, and muscle contraction, excessive intake can lead to health problems, especially for the kidneys. The kidneys play a crucial role in maintaining the body's sodium balance. When sodium levels are too high, the kidneys work harder to remove excess sodium from the blood. Over time, this can lead to high blood pressure, which is a major risk factor for kidney disease. High blood pressure can damage the blood vessels in the kidneys, reducing their ability to filter waste products from the blood. This can lead to kidney disease and, eventually, kidney failure. To reduce sodium intake, it's important to read food labels and choose low-sodium options when possible. Foods that are often high in sodium include processed foods, canned soups, and fast food. 2. Red meat. Red meat, such as beef, pork, and lamb, is a good source of protein and essential nutrients like iron and zinc. However, eating too much red meat can increase the risk of kidney disease. Red meat is high in protein, which can put a strain on the kidneys. When the body digests protein, it produces waste products like urea and ammonia. The kidneys filter these waste products from the blood and excrete them in the urine. Eating too much protein can increase the amount of waste products that the kidneys have to filter, which can put a strain on the kidneys. Over time, this can lead to kidney damage and, eventually, kidney failure. Processed meats like bacon, sausage, and deli meats are especially harmful because they often contain high levels of sodium and other additives that can damage the kidneys. 3. Sugar and sugary drinks. Sugar is a type of carbohydrate that provides energy for the body. However, consuming too much sugar can have negative effects on kidney health. High sugar intake can lead to obesity and diabetes, which are risk factors for kidney disease. Obesity and diabetes can damage the blood vessels in the kidneys, reducing their ability to filter waste products from the blood. High sugar intake can also lead to kidney stones, which are hard, pebble-like deposits that form in the kidneys. Kidney stones can cause pain and discomfort, and in severe cases, they can block the flow of urine and cause kidney damage. Sugary drinks like soda and fruit juice are especially harmful because they contain large amounts of sugar and can contribute to weight gain and obesity. 4. Alcohol. Alcohol is a type of drug that affects the central nervous system. It is a depressant, which means it slows down brain function and impairs judgment, coordination, and reaction time. Alcohol is also a diuretic, which means it increases the production of urine and can lead to dehydration. Dehydration can strain the kidneys and increase the risk of kidney damage. Excessive alcohol consumption can also lead to liver damage, which can affect the kidneys. The liver and kidneys work together to remove waste products from the blood. When the liver is damaged, it can't perform this function as effectively, which can put a strain on the kidneys. Over time, this can lead to kidney damage and, eventually, kidney failure. 5. High oxalate foods. Oxalate is a compound found in many foods, including fruits, vegetables, nuts, and seeds. While oxalate is not harmful in small amounts, consuming large amounts of high oxalate foods can increase the risk of kidney stones. Kidney stones are hard, pebble-like deposits that form in the kidneys. They can cause pain and discomfort, and in severe cases, they can block the flow of urine and cause kidney damage. High oxalate foods include spinach, rhubarb, almonds, and chocolate. It's important to eat these foods in moderation and drink plenty of water to help prevent kidney stones. Drinking enough water can help dilute the concentration of oxalate in the urine and prevent it from forming kidney stones. 6. Caffeine. Caffeine is a natural stimulant found in coffee, tea, chocolate, and some energy drinks. While moderate caffeine consumption is generally considered safe for most people, excessive intake can have negative effects on kidney health. Caffeine is a diuretic, which means it increases urine production and can lead to dehydration. Dehydration can strain the kidneys and increase the risk of kidney damage. Additionally, some studies suggest that caffeine may increase blood pressure, which is a risk factor for kidney disease. It's important to consume caffeine in moderation and drink plenty of water to stay hydrated. 7. High phosphorus foods. Phosphorus is a mineral that plays a crucial role in bone health and energy production. However, excessive intake of phosphorus can have negative effects on kidney health, especially for people with kidney disease. When the kidneys are healthy, they help regulate phosphorus levels in the blood by excreting excess phosphorus in the urine. However, when the kidneys are damaged, they may not be able to excrete phosphorus as effectively, leading to high phosphorus levels in the blood. High phosphorus levels can weaken bones and increase the risk of heart disease. Foods that are high in phosphorus include dairy products, nuts, seeds, and whole grains. It's important for people with kidney disease to limit their intake of high phosphorus foods and work with a dietitian to develop a kidney-friendly diet. 8. Artificial sweeteners. Artificial sweeteners are synthetic sugar substitutes that are used to sweeten foods and beverages without adding calories. While artificial sweeteners are generally considered safe for most people, some studies suggest that they may have negative effects on kidney health. For example, some research has found that consuming large amounts of artificial sweeteners like aspartame and saccharin may increase the risk of kidney stones. Additionally, some studies suggest that artificial sweeteners may increase the risk of kidney damage in people with diabetes. It's important to consume artificial sweeteners in moderation and talk to a healthcare provider if you have concerns about their effects on kidney health. At the end of this video, subscribe to the channel if you like the content, and put a like on the video because this will make this video spread to the largest number of people who need help.